Welcome to Straight Talk with My OBMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write on all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org.
Other policies that come to mind surround those involving sanitation, right? How, in the suburbs, we have to have septic systems in our homes that can accommodate the number of persons so that we can prevent pollution of our water sources, and we can prevent those diarrheal illnesses that in many countries are killing children every day, right? Children and adults. So health policy and public health practice has, some can argue, done more to save lives than even the individual encounters that we have every day, patient to patient. And I am really passionate about these things for sure. We think back on COVID and we all have so many emotions around what was going on with COVID, what was appropriate health policy, what was bad for the economy. But ultimately, there were practices that were put in place that did ultimately slow the spread and saved millions of lives, and we're thankful for those.
Absolutely.
Yeah.
Absolutely. Thank you for sharing that. And the issue with the policies too, it's never ending, right? It's never ending. It's always ongoing because now, for instance, we have social media, and now there's a scrutiny or a research on, hey, how does this affect the mental health of the consumer, right?
Yes.
And is this effect age dependent? And or persons with vulnerability affected differently than persons who aren't vulnerable, meaning if you already have some issues with anxiety or depression, how does your use of social media impact that illness? So, and God forbid you have anxiety or depression, but you don't even know you have anxiety or depression. You haven't been diagnosed. And so you're not even aware of the fact that you have this vulnerability to take that precaution. So social media, for instance, is one aspect that is now coming under scrutiny. Should we be doing more, and not just telling the individual to monitor their use, but should the policies be in place to affect your access to that? And how does this all play a role in our mental health that we were talking about? So in terms of the individual patient, I know a lot of individuals will view public health policies as this is somebody else will kind of come in and shape this policy and create that solution. But how can the individual have a role in shaping that public policy?
Yeah, excellent question. I think that we really all need to be politically active to some extent. And for most of us, that just means voting, right? So knowing your local politicians and where they stand, and being available to influence them wherever you are. So if that means that you go to church with someone who knows someone who knows someone, talk to them about how you feel and about what you know, and know how those politicians feel about health related things, and vote accordingly.
Mhm.
If someone feels like there ought to be a liquor store on every corner to help the economy, and the dangers of excess alcohol use to the community and the individual, then maybe that's not someone you ought to be voting for,
Mm.
right? Maybe, and beyond voting, maybe you ought to be talking about it. So
Mhm.
there are things that you can do. You can also be involved in various civic organizations to influence the next generation. You
Mm.
can volunteer your time at public
Mhm.
and private schools.
Mm. Mhm.
You can, oh
And
yeah,
talking to your friends, right? Just talking to your friends.
yes,
You having a discussion and, hey, did you know that this person is favors this, or did you know that they plan on doing this? Did you know that they plan on closing the library, or and just reading your local newspaper, making
yep,
sure
yep.
that you are aware of what's going on in your community and in your neighborhood, and just having that sense of empowerment that,
Yes,
my voice does matter. My voice can matter. It may not feel like it, or it may not be apparent in the big scheme of things, but my voice does matter. So when the decisions makers come together, they will at least recall my opinion and
yes,
my stance on this matter. So just having that sense of, hey, I'm going to email this person, or I'm going to just let this
yes,
person know how I feel about this matter, whether it's good or bad, right? It doesn't always have to be against. It can also be, hey, you did something really great and I appreciate that.
right, absolutely,
So
absolutely.
I think all of those things are super important, and just kind of reminding the individual that, hey, we can all play a role in this prevention. So so we can feel empowered. And also, we talked about, going to your doctor. So I think that as physicians, we are used to always we have these interactions with our patients, and then after X number of minutes, we're on to the next patient. But also, I think just sharing with your doctor, right? Just share
Mhm.
with your doctor how you feel. Hey, I am happy that, the last time I was here, you really helped me through this issue. Or vice versa. You say, hey, the last time I was here, I felt like this could have been done differently, and this is how I feel. So just having that habit of sharing what we're feeling with the persons that it affects, not necessarily with I think a lot of people kind of go on social media and rant and rage, but really you can also, there's a lot of power in a one-on-one conversation with a person that's actually
Yes,
involved.
yes, yes, for sure. Right, right. Why talk around them about them and about them when you actually can speak with them and to
Right,
them? So
right.
yeah, I like that.
Absolutely.
I like that.
So that is how so public policies can shape some of what we do. What do you think is some of the I know we have talked about this before. We talked about the the pharmaceutical industry and our whole medical system, our whole medical ecosystem, how not necessarily on a political policy level, but on the medical policy level, how our system kind of favors curing rather than
Right.
preventing.
Right, right, right. Yes, 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 yes. I could say a lot on this. Some of it opinion, some of it fact, but take it for what you will. It's so key. So, there are people who won't even go to the doctor because they're
Mhm.
expecting the doctor to want to cure them,
Mm,
right? To offer them a medication, maybe
mhm,
to treat a chronic illness that they don't believe they have. And then there are others who will go to the doctor. So those are don't go to the doctor because they don't want a medication, right?
mhm,
And those who will go to the doctor because they want a medication and they want a cure. You're absolutely right, Dana. I feel having been in this field for, 25 years, right? Graduate medical school in 2000. Um, I feel that we lean too much on trying to cure things so
Mm,
that patients aren't coming in when they're well. I
mm,
want to see people when they're well so we can talk about continuing to keep them well.
mm-hmm,
Some of them are well simply because they're young,
mm-hmm,
right? Not because they're doing the right thing, but because it just has not caught up with them. And those
mm-hmm,
are the people we really want to see. And then we have those older people who are doing everything that they know to do right, and
mm-hmm,
they feel absolutely well, but because they haven't come in, they don't know what's going on with them, and they haven't heard how they could do more to
mm-hmm,
stave off those illnesses. So
mm-hmm,
forgive me if I'm being a little bit tangential, but yes, we don't talk enough in the medical community about coming in when you're well,
mm-hmm,
about even though you're feeling good and you've been eating fried chicken forever, right? And grilled steak,
mm-hmm,
that doesn't mean that that's something that you should continue to do on a regular basis.
mm-hmm,
That there's more that you can be doing. And that a part of staying well, back to the community, is being active in your community
mm-hmm,
to decrease pollution, right? To create green spaces for the children to play
mm-hmm,
so that we can normalize active, healthy
mm-hmm,
lifestyles.
mm-hmm,
So, yes, I would agree with you. The medical community is heavily focused on curing rather than preventing,
mm-hmm, mm-hmm,
or on managing chronic illness rather than reversing chronic illness, unfortunately.
right.
And I think that what we need to be doing is partnering more closely with the public health
Mm-hmm,
community and shifting our resources from tertiary care. Now, I'm speaking probably, this might be sacrilegious to some, but I
mm-hmm,
believe that we probably ought to be shifting some of our resources from tertiary care to pre-primary care, to more
mm-hmm,
preventive care, to more
mm-hmm,
preventive education, to more community-based interventions
mm-hmm. And
such
when
as green spaces and gun control and anti-violence activities that are going to
mm-hmm,
make people not interested in
mm-hmm,
urban violence,
mm-hmm,
right?
mm-hmm.
Urban and suburban violence. Yeah,
Right, right. And just so we know, the tertiary, when we talking about tertiary care centers, those are the mega medical hospitals, right, rather than medical centers. And they're, very sophisticated, and they do provide an excellent
they do. They
resource
do. They
for the
do.
community. So no one is saying we do not need these.
Absolutely.
However, in an as we have limited resource, we
Mhm.
want to think about a balance of, okay, we're putting millions of dollars into building this huge, fantastic center to kind of have heart surgeries and colon cancer surgeries and mastectomies and all of these things. How about we also fraction some of those dollars to community-based services that may not be you may not necessarily see on a billboard or in an sophisticated, sexy ad or something, but these community-based services actually
Right.
do help
Right.
prevent the illnesses where you are needing the huge mega tertiary care centers.
Absolutely. To bring it home, Dana, what that makes me think about is, in an ideal world, maybe making it policy that there cannot be a food desert, right? So
Mm.
food deserts are um, areas where people live and just don't have access to fresh fruits and vegetables.
Mhm,
Maybe they only have a fast food restaurant, for
mhm,
example, and they drive many, many miles to get
mhm.
to a supermarket or to get to produce.
Right.
Okay. Maybe that could be a part of our public health policy. And in order to make that happen, we would need dollars from Health and Human Services to make that happen,
Mhm,
right? Maybe when planning communities, um, franchises or stores, instead of being able to add another supermarket in an area that's already saturated,
Mhm.
maybe they would have to have fulfilled a requirement of
Mm.
going to other areas, having a certain number. I don't know because I don't work on the policy side, but I
Mhm.
have people who do work more closely in public health, and we
Mhm.
agree that the distribution of healthcare resources is skewed
Mhm.
towards tertiary care, and there's a lot that could be done on the prevention side.
Mhm.
Even around education and health education in the schools, and
Absolutely.
availability of healthy foods in the schools. At
Mhm.
one point, they were talking about vending machines that had fruits and vegetables. Now, I've been out of school for a very long time, and maybe they have that by now. But if they don't, that's something that we should be putting in place,
Mhm.
in my opinion.
Absolutely. And one of my big things also, like we all have our things that we look at. Like I remember when
Mhm.
we were looking for a home, I was like, we need a sidewalk. Why not have every
Yes.
builder, why not mandate a sidewalk, especially a sidewalk that goes to a grocery store or to the park?
Nice. Yes. Yes, I
Because
love that.
I
That
remember
could make a difference.
absolutely,
Yes.
because elderly people don't necessarily want to drive, have the capacity to drive, and you need to be able to shop at the grocery store and you need to be able to go to the park to get your exercise in and your
Yes.
socialization in, so again, they cannot, that's something that has to happen on from a public policy standpoint and not happen on an individual level. And so
And those are types of things, Dana, sorry to talk over you, that happen locally, and
Mhm.
not necessarily on a federal level. It might get
Right.
federal later, but that happens locally.
Mhm.
And as you said earlier, we have more influence locally than we think we do. We
Mhm.
all live in some semblance of a small place. So, for
Mhm.
example, I came from Brooklyn, New York, and Brooklyn is one of the five boroughs of New York City, so very,
Mhm.
very large. And so
Mhm.
that could be an overwhelming thought. Oh my goodness, how can I make a change in my
Right.
community? I need to be a councilman or I need to be the
Mhm.
mayor. Absolutely not. In
Mhm.
each community, you have your much smaller levels of government
Right.
that you can influence,
Mhm.
okay?
You have your
So,
congressman, you
you
our
have your city council,
congresswoman,
right? You have your
yes.
districts.
Yes.
Absolutely, absolutely. And change can be made at those levels
Mhm.
when communicating with those people and attending the appropriate meetings.
Mhm.
So
Mhm.
here, where I live now, my county has, I believe, twice a month, um, a commissioners meeting that's
Mhm.
open to the public. And
Mm.
there's space on the agenda
Mhm.
for the public to talk about whatever we want to talk about. And we
Mhm.
can bring our issues to the forefront. And
Mhm.
what I've seen is that if you bring it up enough times,
Yes.
somebody's going to work to do
Yes.
something so that they can help you to get what you need. And people will follow you if
Mhm.
it's a
Mhm.
cause that they see that is important enough.
Mhm.
And the same with health and healthcare. We can get things to the forefront.
Mhm. Mhm. You're inspiring me because there's some things I'm like, I've been saying, oh, we need a sidewalk to our local park for the longest. So I need to let the mayor know that, hey, this is something we want to get done. And
Yeah.
yes, thank you for reminding me, also the listener and the host of this very important ability. As we're finishing up, I know you had mentioned some of the things from an employer employee relationship that may be able to happen to help promote health and wellness. I know, like, of course, one of the big things is access to health insurance,
Mhm.
which most employers customarily provide to their employees. But what are some of the things that they can do to help improve beyond accessing health insurance? What are some of the things that they
Sure, I think that
can
some workplaces, and it's becoming more and more mainstream to have workplace wellness programs, like
do?
fitness challenges, for example,
Hmm.
and some programs I believe they provide monitoring apps and monitoring equipment or devices like blood
Hmm.
pressure monitors or um, smart watches that or
Hmm.
apps on the smartwatch that can monitor and measure and help people with their personal goals. Also, there are fitness centers within large corporations that
Hmm.
help people to get their exercise in before or during or after the workday. I think those are some of the things that the workplace has done. And I know that my workplace haven't mentioned them explicitly as of yet, and probably don't need to all for the podcast.
Mhm,
But we also offer a service that is essentially a concierge service that
mhm,
is a form of employee assistance program where
mhm,
you can access mental health resources
mhm,
without using your insurance, and it's
mm,
extremely confidential.
mhm,
They offer a concierge service that helps people to do what they need to do when they're super busy. You
mhm,
know, their dry cleaning, plan their vacation, for
mhm,
example, help
mhm,
with backup childcare should an emergency arise. So
mhm,
those are the types of things that the workplace can do because stress plays a large role in the chronic diseases that we suffer from these days. And
mhm,
when the employer recognizes that a mentally healthy worker is a productive worker, that
mhm,
goes a long way. So
mhm,
there are things that workplaces can do, and
mhm.
these are some of them. Yes.
Absolutely, absolutely. I work still a practicing OBGYN physician, so I work at night a lot, right? Because babies, they like to come off hours. Um, and the nurses, I'll see, I'm still waiting for the the hospital that'll have a sleep pod.
Oh,
that's
yes.
my that's my goal or my hope for the nurses, because the physicians, we do have a sleep area. Granted, we are there for longer hours, but still, it's nighttime. And I'm like, if you get a 30-minute break and you want to take a nap, you really should have a spot where you can go and take a nap, because you're working at night. So that's just my pie in the sky hope for people who work at night. But yes, and also for people who work during the daytime when their employer allows, or some people are fortunate enough to be on a campus where they can go out and walk, right, for that 30-minute break. So they can get some well needed fresh air, get some sunlight, and come back feeling very refreshed. And some people are on a campus where their employers have fresh food available, right? Healthy food. So that takes the burden off the employee having to do the food preparation in advance. You just have to show up, order your meal, and you're good to go. So those are some of the really great options, or having, of course, healthy choices around if they don't have it right there on site on campus. And also creating groups of promoting group therapy. My current employer, I noticed they have like a camp for people who have lost loved ones. So,
Mm,
just kind of having a recognition that your employees are human beings having human
mhm.
experiences, and
Yes.
human experience does not just stop once they cross the threshold of the office or of the workplace. And so these are things that we have to address. We cannot just ignore. And as coworkers, right? Just can continue to recognize that, hey, check in on our coworkers to
Yes.
make sure that
Yes.
they're okay. We don't know what they may be going through. So, is there anything else you would like to add, Dr. Loida, on
Yes,
this
yes. It's amazing how quickly the time went.
topic?
We've talked
Yes.
about so much already. I just want to go back to one thing I mentioned earlier to make sure that I didn't misspeak or run the risk of being misunderstood. When I talked about processed foods, what I was referring to was, essentially prepackaged items. Getting
Mhm,
your food at the supermarket and preparing it at home is what we want you to do,
mhm,
right? So
mhm,
making those smoothies is absolutely wonderful, right?
mhm,
Those
mhm,
fresh fruit and vegetable smoothies is great.
mhm,
Steaming or sautéing those vegetables is wonderful,
mhm,
as well as having the whole grains and the yeah, and the other protein sources that we have, including beans, if you're mainly plant-based, and
mhm,
or they're healthy, lean um, meats and fish. I tend to promote plant-based, but do
Mhm,
realize that seafood and chicken
mhm,
and poultry can be quite healthy. And for some people, lean red meat as well, even though it's not
mhm,
something that I promote in my practice.
mhm,
So I wanted to get that point out. I also wanted to talk a little bit more specifically about the screening because this is just so, so key. There are many
mhm.
people who aren't getting those colorectal cancer screenings that they should be
Yes.
getting. So I want to let you know that the recommendations are strongly for adults aged 50 to 75 years to get a
Mhm,
colonoscopy at least every 10 years. Okay. Colonoscopy is the best test that you can get. You do a bowel preparation, a laxative
mhm,
the night before. You come in, you go under anesthesia, and a camera is placed in your rectum that looks throughout your large bowels to look for any cancers or precancers. And
mhm,
those precancers, if found, or polyps, can be removed and treated right away. There are
mhm,
two other options. One is the fecal immunoassay test, which is very inexpensive and very easy to do at home, where
mhm,
you simply send a sample of your stool in the mail to a lab. It gets analyzed for signs of blood or cancerous DNA,
mhm,
and your doctor gets that notice, and then you're sent for a colonoscopy. That should be done, that fecal immunoassay test, at least every 2 years if that's the
mhm,
screening strategy that you use. And then there is another test is fecal DNA test. There's
mhm,
one company that provides that, and it's called Cologuard. It is quite expensive. In most cases, it's just as expensive for the consumer as a colonoscopy. So it's not
mhm,
something that I routinely recommend, but some people do choose to use that as a screening strategy, and it is acceptable and it is great. You do it once every 3 years to look for signs of colon cancer. And if
mhm,
positive, then you move forward and do the colonoscopy. I
mhm,
highly recommend colorectal cancer screening because it's a
mhm,
form of early detection and it's a way to prevent colon cancer and advanced colon cancer because
mhm,
it can find pre-cancer and treat it on the spot. The
mhm,
next I want to go back to is mammograms. So for most people, I do recommend a yearly mammogram. The
mhm,
United States Preventive Services Task Force recommends women age 40 to 74 year old get a mammogram at least every 2 years. So I want to just, put that out there and let you know that
mhm,
breast cancer, for the most part, is highly treatable and certainly curable. How
mhm,
many of us know survivors of breast cancer? Just think about those breast cancer walks that are held in
mhm,
just about every city every year. And you see hundreds, if not thousands, of women who are
mhm,
out there walking because they've
mhm,
been cured of breast cancer.
mhm,
They have been cured of breast cancer because they went in and they had their breast cancer detected early before it had a chance to wreak havoc in their body and metastasize and kill them. So I want you, the listener of this podcast, um, Dr. Smith, I want your listeners to be amongst those who are detected early and cured if they're going to get breast cancer.
mhm,
Then lastly, I want to mention for our men, the men that we love, not lastly, but I want to mention PSA testing, that's prostate specific antigen blood testing.
mhm,
It's a little bit controversial, and it can be controversial because it's such a good test. It's an excellent test. It's so sensitive, and it can detect this prostate specific antigen in the blood, even when there's nothing going wrong with the prostate. So this
mhm,
can create anxiety, but the good news is that it will miss very little. So I routinely do recommend this and have this conversation with my male patients. Hey, let's check it. Maybe not every year, but let's certainly check it to make sure. Because if we don't check it, we just may not know, and we may not be able to treat and cure your prostate cancer. Again, most prostate cancer or many prostate cancers are not very aggressive and can be treated and cured. And then lastly, that lung cancer screening. If you
mhm,
happen to be a victim of the tobacco industry and became addicted to nicotine, and had been a smoker for many, many years, we want to get you involved in a screening program where we do low density CT scanning once per year to see if we find any early small lung nodules that we can then continue to monitor and
mhm,
that we can also treat. Lung cancer doesn't have to be deadly. And
mhm,
so again, talking to your doctor about these screening tests can actually save your life. We want you to be there for your family. We want you to have a great quality of life, and we
Mhm.
want them to have great quality of life by having you around for them. So again, thank you for listening to this podcast. And Dana, thank you so much for having me, for inviting me. I feel so
Mhm.
privileged to be able to share share my knowledge as well as
Mhm.
my opinions with your listeners as if they were my patients. You
Of
know, as I
course.
care about you, I have to care about your listener as well.
Of course, of course. And I would be remiss, I have to mention
Yes,
your pap smear,
of
right?
course, of
So the
course.
pap smear, a
Yes.
very simple, very,
Oh,
very
yes,
simple test. It's done
yes.
every 1 to 3 years, depending on your risk and depending on your previous results. And it does prevent cervical cancer because if it's detected very early, it is curable. It
It
is
is curable,
curable.
curable.
And
And I'll
then,
add to this, Dane, I'll add about the pap smear is that our testing has become so excellent and so
Mhm.
sensitive that for our lowest risk women who also get tested for HPV, who have
HPV,
co-testing,
right?
they actually can wait 5 years. So
Mhm,
don't be afraid
mhm,
if you come
mhm,
in and you don't want to get that yearly pap smear, so you decide
mhm,
you don't want it at all. No need to decide that. Get it
mhm,
today and you may not need it again for 5 years. And that
mhm.
was revolutionary. Who Nobody liked that once yearly pap smear, right? But
No.
now it can be even less frequent. So we encourage you to get that. Thank you so much for mentioning that,
Mhm,
Dana. So important. And you don't need two doctors. I want our women to know that. If you're average risk, you're no longer looking to have babies, maybe you're in your 40s, you don't necessarily have to get your pap smear done at your gynecologist's office. But
mm,
someone like me, an internal medicine primary care physician, can do your pap smears routinely. And of course,
mm,
if we see something that is beyond our expertise, perhaps you need a further testing, then we have partners who we can send you to who are board certified gynecologists like Dr.
mhm,
Smith who can take
mhm.
better care, who can take over that care.
And we would love to. And want to mention also when you are getting the pap smear, you getting the pelvic exam done, and then that part where we place two um gloved finger in the private area, that's actually a screening test for ovarian cancer. So while we're doing that, we're not, I know nobody likes it and everyone's uncomfortable, but that's actually to check to make sure your ovaries are healthy and in a normal size. So you're getting two cancer screening done at the time that you're getting that done. So, there's just so many things. And we're really we talked a lot about policies, but we are blessed to live in a country with resources where
Yes.
this is part of our normal everyday expectations. We have access to these because globally that's not always the case. Globally, some people do
Mhm.
not have access to routine pap smears or, God forbid, colonoscopies even. And so we're blessed that we are in a resource rich nation that we do have access to these. We just have to make the choice to use them to our advantage. So, with that, I want to just thank you, Dr. Loida, Dr. Bonnie, for being our guest on Straight Talk with My OBMD. And thank you for taking the time to speak to myself and most importantly, to speak to our listeners so that they can learn how important the power of prevention is in their lives and how they can feel empowered to utilize prevention in their road to health.
Thank you for having me.
All right. So, to our listeners, thank you for tuning in to Straight Talk with My OBMD. You can find this conversation on our website, as well as multiple resources on the topics that we have discussed, also written on our website. Remember, on myobmd.org, everything you see, read, and hear are authored by physicians, so you can trust the content that you are receiving. Thanks again for tuning in to Straight Talk with My OBMD. I'm Dr. Dana Smith. Thank you for listening to another episode of Straight Talk with My OBMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with My OBMD.